If simple activities are leaving you out of breath, you might want to reconsider the reason why. By the time 80% of people with chronic obstructive pulmonary disease, or COPD, receive their first diagnosis, they've already had moderate to severe symptoms and have lost significant lung capacity. Here to bring awareness to COPD are Dr. David Menino and patient Candace Norris. Good morning to you both.
Yes, good morning.
Good morning.
So first off, why don't patients open up about their symptoms, doctor?
Well, Amy, there may be many reasons why patients don't open up to their physicians. They may not realize that they have COPD. Because sometimes patients attribute their symptoms to simply getting older. And sometimes the symptoms, like it might be easy if you're coughing and wheezing and very short of breath, but if your main symptom is just being very fatigued, you may not attribute to that. And then patients can be embarrassed about their disease, for example, and Candace can talk about that in her situation.
Okay, is that because we have such a high population of smokers still?
Oh, I think it's a number of factors. It relates to both historic smoking, but there are other risk factors for COPD other than smoking.
Okay, so Candace, when you were diagnosed, what were some of the symptoms that you were having? And how old were you actually when you were diagnosed?
My main symptom was shortness of breath. It can be like when you're in the middle of a flare, it can be like trying to inflate a brick when you're breathing in. It's very challenging, it's very difficult, and you really need to let your doctor know what symptoms you are having, because there are others, but that was my main one.
I actually didn't know that you could be diagnosed with COPD at such a young age. Is that common, doctor?
It's not typical, but it does happen. And I've had some patients in their 30s diagnosed with COPD, but more commonly it's something that is diagnosed in the 50s and 60s, although I think there's evidence that COPD can start in people much younger than that.
So what advice do you give patients to manage their COPD?
Well, certainly, COPD is a disease that can be managed, and I always tell patients that that our goal is to not only add years to their life, but add life to their years.
And Candace, since you've been diagnosed, what advice would you give to people that are going through the same thing?
Well, I really came to terms with the fact that I had COPD and really opened up with my doctor. Followed his healthcare plan, developed some of my own with my youngest son, and I participate in 5Ks. I just keep moving.
And doctor, where can we go so we can get more information?
So I also recommend the website of the COPD Foundation, which is copdfoundation.org.
Find out more by logging onto our website, fox4morningblend.com.